Welcome back. In this video, I'll teach you everything that you need to know about third-degree heart block. Third-degree heart block is caused by complete cutoff between the atria and the ventricles. Normally, we have the atria contracting first and then the ventricles. But if you cut the link between these two parts, the atria will be contracting on their own, and so do the ventricles. In the ECG, you will see bradycardia, and you will see that there is a persistent or a specific rate between the P waves and the QRS waves. So the P waves will be contracting on their own, and these are the atria, and the QRS complexes will have the same distance in between them, but they will not be followed by P wave, which is indicative of ventricles contracting on their own. So again, complete loss of synchronization between the atria and the ventricles, which translates in the ECG to complete loss of synchronization between the P waves and the QRS complexes. The most common causes include heart diseases, especially coronary artery diseases, infections of the heart, congenital heart diseases, inflammatory conditions like myocarditis, which can be autoimmune, some electrolyte disturbances, and cardiac surgeries. The patient will experience lightheadedness, and they might have syncope or fainting, and of course chest pain. In a normal patient, when the atria contracts, it fills the ventricles with blood. So the ventricles contracts afterwards and pushes this blood into the body. But when the ventricles contract on their own without the atria contracting first, the ventricles will be essentially pushing very little blood to the body. So it's a state of ineffective or inefficient heart contraction. The best treatment for these patients is pacing, which is basically overriding the cardiac electricity and enforcing the atria to contract first, followed by the ventricles. The cardiac pacers can be temporary or permanent. The temporary is faster to install, and you can have it for patients who are currently undergoing this condition and who cannot go immediately to surgery. And the most definitive treatment is, of course, permanent pacemakers. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.